Should you double boil vegetables to cut potassium and CKD? Managing potassium intake is a key part of caring for kidney health, especially if you have chronic kidney disease. Many people wonder if double boiling vegetables is a good way to lower potassium levels. The answer is yes, but with some important details to consider. Double boiling vegetables, especially potatoes, is an evidence-based method that can significantly reduce their potassium content. When you peel and cut potatoes into small pieces and boil them in a large pot of water for at least 10 minutes, you can reduce the potassium by about half. Some studies show reductions ranging from 40 to nearly 60%, and if you follow boiling with a short soaking in fresh water, the reduction can go up to 70%. The process works because potassium is water-soluble, meaning it leaches out into the cooking water. When you cut the vegetables into smaller pieces, more surface area is exposed, allowing more potassium to escape during boiling. Draining and replacing the water for a second boil helps remove even more potassium that has leached into the vegetable tissue. For someone with kidney disease, this technique can make foods like potatoes safer to include in their diet. A medium potato can contain over 1,000 milligrams of potassium, which is more than half of the daily limit for many kidney patients. Baked potatoes with skin can have nearly 930 milligrams, and without skin, about 610 milligrams. These amounts can be too high for those needing to restrict potassium intake. The recommended method involves peeling the potatoes, slicing or dicing them into small pieces, boiling, draining, then boiling again for about 10 minutes, and draining once more. This process can cut the potassium content in half, leaving roughly 100 to 200 milligrams per half-cup serving. Recent research suggests that soaking vegetables in water for a few hours or even freezing them before cooking can also help reduce potassium effectively. Instead of soaking for 24 hours, soaking for just 4 hours and then boiling is now considered practical and just as effective. Besides potatoes, other cooking methods like boiling, pressure cooking, and microwaving can lower potassium in various foods, including fruits, vegetables, cereals, meats, and legumes. Steaming and dry heating also reduce potassium but not as much as water-based methods. Double boiling vegetables allows people with kidney disease to enjoy more variety in their diet while keeping potassium levels in check. However, portion control remains important because even low potassium vegetables can add up. Each person's potassium limits depend on their stage of kidney disease, dialysis status, and overall health. That's why working closely with a healthcare team or a renal dietitian is essential. They can help determine your personal potassium limits and whether double boiling fits into your treatment plan. Remember, every individual's needs are different, and what works for one person might not be right for another. Always consult your healthcare provider before making changes to your diet. This way, you can enjoy nutritious, kidney-friendly foods while supporting your overall kidney health and well-being.